Globally, what we're doing is we're bringing world leaders here. Malaysia has been having TOPCOM. This is the 10th year. It's very exciting, and they become a conduit for conversation about preparedness, planning, response, and recovery.
The conference has been very spectacularly planned to the last details. We're enjoying our colleagues, the students, the residents, the doctors. It's been very enlightening. We're learning a lot, and we're here to learn and share information.
Oh, it was wonderful. It is this conference is well organized, and we can see a lot good subject and good peoples, and so I just love it.
This is the 6th edition of WACEM 2022. The first WACEM was incepted in 2016. So WACEM, or we call it World Academic Conference of Emergency Medicine, is all about academics. We're trying to bring all academicians involved in emergency care globally to one platform and talk about emergency care. So this is the first time we've brought almost more than 80 international speakers with involvement in emergency care, talking on various topics in Malaysia. So we are inviting more than 80 international speakers to Malaysia for the first time in its history regarding emergency care. And also talking on the note of TOPCOM 2022. This is the 10th edition of tabletop exercise in disaster medicine, and so tabletop exercise in disaster medicine is all about tabletop exercises.
More than 140 international speakers and Malaysia, and we managed to cover so many areas, pre-conference and conference. Pre-conference for 2 days, as well as the conference, pre-conference for 3 days and main conference 2 days. And we had best of the universities that participated from UK, Europe, US, a lot of scientists, and a lot of in other countries like India too. And all of us have benefited from their knowledge and skills and their sharing of their commitment.
The main mission and vision of this Congress is firstly to present Malaysia to the world and bring the world to Malaysia. So we have been working very hard to restart academics after the COVID pandemic. And as we are aware, COVID literally brought everybody apart. So this main Congress discusses life after COVID and how can we bridge preparedness, policy, and patient care practices with physicians across the world. The main contents of this Congress revolve around clinical practices, preparedness initiatives, and interdepartmental operations for making the lives of patients better in times of crisis as well as in times of need. So this Congress really brings the global experiences together onto one platform to improve the art of patient care in crisis and not in crisis.
But I think the conference is what makes it what it really is. The idea that we get to be around people from across the globe who are sharing their best practices, who are sharing their lessons learned around things that really affect disasters, whether it's on the clinical side or whether it's on the management side of what's critically important.
The majority of them aren't based around disaster management. And I feel like as a future doctor, I would be expecting a little bit more proactive workshops. Because during this period, I think there were only 2 days of workshops. So I feel like in the future, I hope to see a little bit more workshops. Ultrasound, POP, I'm sure we can come up with a little bit more workshops than that, yeah?
We also have various plenary talks and also various lanes from comprising of pre-hospital care, acute care medicine, military medicine, CBRNE. So this conference actually comprises of various topics in emergency care, and we welcome all agencies from that actually respond to emergency care.
We brought forward a few important aspects. One is communication on every level. The next is looking at situations that can be improved through better communication and planning. We've also tried to lead the activities around community response and cooperation.
Google Web Services. So basically, those information can be guaranteed. The quality of the security is guaranteed by them.
We are already having the full spectrum of various courses that are available for the students from undergraduate to postgraduate level. And some courses in the postgraduate level, we are on the only university in the country. And we are known for our dentistry programs. In particularly, we are ranked as #1 by few of websites in terms of offering the program. At the same time, here we are privileged to have this conference that is going on here, WACEM and TOPCOM 2022, which is the first time in Malaysia. And we are looking forward for the near about 100 and over delegates that are coming from all over the world. And we are expecting around 800 participants. As a university, MASA privileged to have this conference on our campus. And we are very proud to host this conference. The vision of our academic institution is we want to be the center of excellence in the region for providing the healthcare education. So this conference vision is also in line with our vision and mission as well.
Yeah, and there are two things important because we have students from almost 70 countries from all over the world. And therefore, we are trying to develop a global education system, especially in emergency medicine as well as disaster medicine. Because this part of the world, we follow the ring of fire. We are one of the highest disaster situations, and we want our community to be prepared. So we are working with the various organizations, especially those who are involved in disaster management. They'll be here the next 2 days, and we are going to show and educate.
in one word, it's magnificent. It's fantastic. We've had a great crowd which was willing to learn, a great crowd which is willing to be part of the fun, and a great crowd which is willing to take this back to their workplaces, be it nurses, be it doctors, be it medical assistants, be it paramedics. We've got a huge crowd, a heterogeneous crowd, and that is the beauty of this conference.
I wish that this conference can be carried out yearly, and it would be good if we can invite a lot more agencies to come and join us.
Disaster response will be need to be participated by all the organizations. So not only hoping from the health side, okay, because the health side is main. Okay, other things, other agencies should be contribute themselves and work as a teamwork for disaster management as well, as we learn in emergency management.
I must appreciate the efforts of organizers for organizing this conference very well.
We can collaborate, we can know each other, we can learn from all over the world. Okay, and I hope that everyone will really enjoy this conference and bring back something so that they can improve our whole healthcare system.
Next year we will make organization in Turkey. This is very important time for Turkey because 100th century republic after Republic of Turkey. This is very important time for Turkey. But this WACEM like a new breed for the emergency medicine in the world. Emergency medicine world need WACEM. So we want to be in collaboration, close friendly collaboration between these all area, first Malaysia, Indonesia, and neighbors country, and not only this Asia and Africa and America, and Europe, and you know Turkey bridge of between Asia and Europe, so we have a lot of contact with emergency medicine society in the world. I think WACEM after this year include more the countries from emergency department.